go through the ins and outs, what's number 2 here? That'd be the auricle, right? Auricle. So these are appendages that help increase the volume capacity of the atria. Okay, so 2 and 14 would be the auricles, right? If we look at this here, number 1 would actually be the right atria. Okay, so if we kind of open this up before we open up this area here.
Right atria.
No, if that's the atria, this would be the ventricle, right? So this is the right ventricle.
Yeah, I'm confused now.
Okay, and that means that this would be the left ventricle. Okay. Earlier we talked about where to auscultate. If you guys remember, where's the best place to auscultate the mitral valve? The fifth intercostal space, the apex, right where the nipple's at. That's where you want to be at. Because if you open this up, where are you? Look at that, beautiful. You can auscultate that valve up here. It's going to be the aortic, right on the right, about the second intercostal space, right sternal border. Okay. What else are you seeing? You're seeing blood flow. You're seeing structures penetrating the atria. What structures penetrate the atria to allow for drainage? Up here, superior vena cava, which is this one here, number 3. Number 4 is inferior vena cava, right? That's what you're seeing here, correct? And then, you're not getting me, by the way. Just getting the heart. No, I'm just kidding. And then you've got this guy right here, 25. You guys see 25? What's 25?
Oh.
Coronary sinus. And it drains, this is the structure that it's actually draining, which is I think this is the coronary vein, the great coronary vein. Okay, so all these, the myocardium is being drained by this large vein that's going to drain into this structure here. Does that make sense? So 3 structures are draining into the right atrium. And then 24 is the remnant of fetal development, the fossa ovalis on the fetal side. And then after we're born, what happens? It seals up and it becomes?
The fossa ovalis. And then fossa.
Yeah, we said foramen ovale during fetal development, and then after you're born, fossa ovalis, right? Make sense? And then what else do we have? We talked about the vena cavas, the 3 structures. Now we're talking about blood flowing. Blood flows through the SL valves. What's number 6 here? Pulmonic SL valve, so this would be? Pulmonary trunk. And then you've got, I think it's 31 and 33. You got 2 lungs, so they're going where? Pulmonary veins or arteries? Pulmonary arteries. Okay, don't confuse that. Okay, pulmonary arteries. It'll be a big thing in this chapter. Pulmonary arteries. In the lungs, they get oxygenated. Blood flows back through these 4 structures that are here, which are the pulmonary veins, right? Veins bringing blood back to the heart. Correct. That's the definition of a vein. You see the 4, 1, 2, 3, 4. So they're all draining into the right atria, down into the right ventricle through what valve is this guy?
Left, right?
The left, yeah. So the mitral valve, aka bicuspid valve, it goes up the SL valve, it goes up I think this is the ascending aorta, then the aortic arch, right? Mm-hmm. And then of course the descending aorta, it'd be the thoracic aorta, then the abdominal aorta as it kind of descends. There's 3 branches here that we want to keep in mind and note. What's number 9 right here, the first one? Brachiocephalic trunk. Because it's going to become the brachial artery and the cephalic artery. You're going to see it divide later on, okay? So it's going to feed the arm and then go up and become the right common carotid, okay? What's next? Common carotid. The left common carotid, correct? Mm-hmm. Because this one will become, on the right side, the common carotid, right? And the subclavian artery, it'll branch off. But this is going to be the left common carotid. And then number 11, it's going to go right underneath the clavicle, the subclavian. Very good. So those are the 3 major structures that you want to keep in mind, the branches. Okay? And then for the heart on the outside, the only thing I really ask about is the coronary artery, is the right coronary artery. Now we're seeing here, this is the left. The left has 2 branches. It's the anterior descending coronary artery, and then the circumflex artery. And you can see how the circumflex artery kind of feeds the posterior and the left ventricle, right?
Is the great what is it, vein? Cardiac vein, does it go to the front too?
There's a bunch of smaller veins that they all will ultimately drain into this vein.
Okay.
That's why I only care about this one.
Okay.
Because you have a bunch of little divisions, but they're all ultimately going to drain into this structure here. Okay. That's the one that we're study about. And if you're comfortable with this, what we just talked about, that's a big part of your midterm. Make sense?
Which one's the widowmaker?
The widowmaker.
Anterior descending, right?
The left anterior descending is going to be that one.
So is it?
It's going to be kind of like this is the left anterior descending, and you see how it kind of like branches off. When these little branches, they become very small and kinked, and that's where clots most likely occur.
Okay.
And then it's like called the widowmaker because it basically kills.
Yeah. It's the common.
Cool.
Yeah.
Awesome.
Good.
Thank you.
Okay.
Thank you.
There you go.